WIDU Community Room.
The We Do Radio Network. WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making rounds live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making rounds live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome back to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Ladies and gentlemen, before we even get into the day's topics, I want to let you know that you need to stay tuned for a chance for you to win a pair of tickets to Halloween at the Botanical Garden. This is a Halloween event that they have at Cape Fear Botanical Garden, and it's going to feature thousands of lights, and there's going to be Halloween themes, and there's going to be festivities, and there's going to be so much fun. And like I said, we have a chance for you to win tickets before the end of the broadcast today. Now, if you want to find out more information, maybe I didn't give you enough about it, you can go to Cape Fear Botanical Gardens Facebook page, and everything that I just told you will be on that Facebook page. Now, ladies and gentlemen, today we're going to dive into topics that affect women of every stage, from pregnancy to prenatal care to overall women's health. We're also going to highlight an upcoming event called the Flourish event, and it's a celebration of health and wellness and community resources. So joining us today, ladies and gentlemen, we have Dr. Karen Wilson. Dr. Wilson is an obstetrician and gynecologist specializing in maternal fetal medicine at Cape Fear Valley Health. Dr. Wilson, she works closely with high-risk pregnancies and provides care for expected mothers and their families. Now, we also have in the studio a lady by the name of Shelby Vermillier, and she is new to the marketing department at Cape Fear Valley Health. She is the marketing coordinator, and Shelby is here to give us the inside scoop on an event called Flourish, and what to expect, the resources that are available, and why this event is so important to women in our community. Now, we have a lot to discuss, so let's get started. First, let's bring in Dr. Wilson. Dr. Wilson, thank you so much for taking time out of your busy schedule to be with us today.
Well, thank you for having me.
And Dr. Wilson, tell us a little about yourself and what made you pursue a career in OBGYN?
Yeah, of course. Well, I originally grew up in California, and I joined medical school after high school or after college, and joined the Army during that time, and recently retired from the Army as well. So here I am today. But when I was really young, I was very fascinated with the birthing process, and when I was going through medical school, I just loved my OBGYN rotation, and I couldn't see myself anywhere else, so here I am today.
Well, first, thank you so much for your service. Let me say that. Thank you very much. Now, what led you specifically into the maternal fetal medicine field?
Yeah, that's a mouthful, isn't it? Yeah, I mean, women's health was where I was at, and I just felt very energized. Every morning I was going up to labor and delivery, and I just loved managing complex, high-risk pregnancies. It was just a real passion of mine. I am actually very passionate about pregnancy and ensuring that these women get the best care that they can, and for their families as well. And so, because that was sort of my calling, I decided to pursue fellowship in maternal fetal medicine.
Ladies and gentlemen, we have in the studio with us right now Dr. Karen Wilson. She's an obstetrician and gynecologist specializing in maternal fetal medicine at Cape Fear Valley Health. And Dr. Wilson, what keeps you motivated every day? Because this seems to me like you would have certain days to where you could be high on a cloud, and then there's other days to where you could hit rock bottom. Speaking from a person that suffered from a stillbirth. And so how do you stay motivated every single day?
Well, first of all, I'm so sorry you had to go through that. That's a very traumatic experience. But there's a lot that keeps me going every day, and it really is a special time for me to be able to work with people like you during these vulnerable moments. And I think it's a privilege for me to be able to be a part of these critical times during pregnancies. And with that, that just keeps me going every day.
Ladies and gentlemen, Dr. Karen Wilson with us in the studio. Dr. Wilson, for our listeners who may not know, what is the difference between a general obstetrician and a maternal fetal medicine specialist like yourself?
Yeah, that's a good question. We are double boarded, so we are OBGYNs and maternal fetal medicine specialists that have gone through two different trainings. You can kind of consider us the special forces of OBGYNs. And we come in and we help manage complex high-risk pregnancies.
Can you share what kind of services that you and your team provide at your Cape Fear Valley Health Clinic?
Yeah, we have a lot of exciting things that go on, but we definitely focus on complex pregnancies, whether that pertains to the mom or the baby, any health condition that could affect either one of those. A lot of it involves consulting on these and providing management care plans. And I think kind of a new thing for the community is we'll be in the hospital more now. So we'll not only on the outpatient side, but we'll be involved in the inpatient services, providing care to these complex pregnancies.
That is awesome. Now, what are some of them, as far as what you see, what are some of the most common conditions or challenges that you see as a physician?
So many every day, but a lot of pre-existing maternal conditions such as hypertension, diabetes, autoimmune disorders, or conditions in pregnancies such as multiple pregnancies, gestational diabetes, a condition called preeclampsia, which is a unique condition in pregnancy, or any birth defects. Those are the things that we get called in to manage.
Dr. Wilson, let's talk about technology, because technology is changing everything nowadays. How has technology changed the way that you're able to care for both moms and babies?
Well, it's amazing, and I've been doing this for over 20 years, and the things that we are able to do now is just so advanced, and it will be advancing more over the next few years. But with the new technology, we are able to see things and diagnose things in pregnancies with the baby much earlier, like around 10 to 13 weeks. So you're still in the first trimester. We can identify, genetic conditions or birth defects, and it's really critical for the families who get this information. It helps them navigate what they might be dealing with.
Now, you mentioned the families, Dr. Wilson. How do you support, we have an idea of how you support the mother, but how do you support the partner and the families during these high-risk pregnancies?
Well, families are just as important as the mother because they're their support system. And so we recognize that, and we definitely involve them in the care. So we make sure that they are involved in everything that's going on. We communicate with them, speak in a clear language so that they can help support the mom and the baby. And this information sharing really helps us build a trusting relationship and a foundation for them to continue their care and bring this new child into their life.
Ladies and gentlemen, our in-studio guest, Dr. Karen Wilson. She is an obstetrician and gynecologist specializing in maternal fetal medicine at Cape Fear Valley Health. And we are talking everything about women's health today. And Dr. Wilson, one thing that just popped into my head, and I'm only asking this, is because we have a young lady that I work with that just recently learned that she is having a baby boy in February. And I am on her about prenatal care. How important is prenatal care?
Very important, and I'm glad you're stressing that to her, and exciting for you as well. But yeah, prenatal care is so important for families, or for the women and the baby. It's a time for us to help them answer any questions, assuage any fears they have, give them support systems that they may need, identify any lapse in care or things that they may need to deal with. And it also helps build a relationship with their OBGYN team, because this is a really critical part of their life, and they want to feel comfortable having this baby and going through this pregnancy with their providers.
Let's talk about lifestyle, nutrition, and mental health during pregnancy. What advice would you have for patients regarding those three?
Well, I think this is an important time to think about you and prioritize your health. I mean, I think as moms, we so often focus on everyone else around us, but it's really a time for you to make sure that you're taking care of yourself, eating well, doing light daily exercise, make sure you're going to your prenatal visits like we just talked about, and avoiding any harmful exposures, and really focusing on you and the pregnancy.
Dr. Wilson, could you stress the priority of taking care of self to our listeners and to our viewers? Because a lot of folks, they don't do it. They feel guilty, how important is it to focus on self?
So important. It is critical. The things that you do during pregnancy impact the health of your baby, and you want to do everything right from the get-go, and you just kind of have to put aside all those extraneous things that are invading your ability to take care of yourself and focus on you and your future child.
Dr. Wilson, what do you wish more women knew about taking care of their reproductive health? We're not talking about just birth, child rearing ages. We're talking about all stages of life.
Yeah, well, I think that's really important that, OBGYNs can help you through all stages of life. And I think it's really important that women go to their OBGYN. We understand where you're coming from. And sometimes you can open up to us about things that you might be experiencing, and we can really provide you with the resources to take care of medical conditions that might be developing. We may be able to help you manage that as well and provide preventive care, so that you can enter into the later stages of life, healthy and you're tip-top shape.
What about our listeners, our female listeners and lady listeners who are going through menopause, have already gone through menopause? Their attitudes are like, we don't worry about reproductive systems anymore. So what advice do you have for them?
Well, we are here for that too. I think this is actually a really hot topic, right? Menopause. Yeah, we are here. We are there for you when you are making that transition in life. And it's a really difficult time for women, and it's a really critical time for women as well, because it can affect your mental health, it can affect your family state, and just a lot of things are going on. And we understand that. So go see your OBGYN, talk to them about what you're feeling, and there are things out there that we can do to help you.
Ladies and gentlemen, our guest this morning, Dr. Karen Wilson, obstetrician and gynecologist specializing in maternal fetal medicine at Cape Fear Valley Health. We're talking about women's health today on Cape Fear Valley's Making Rounds Live. Dr. Wilson, let's talk about myths and misconceptions. What do you hear from your patients that you want to clear up?
A lot of things, I think. They're like, I can't dye my hair. You can absolutely dye your hair. You're pregnant, but you are not in a bubble. And you can do things, normal things, and actually it's important. Like I talked about earlier, exercise is important. You should keep that up, because you will lose muscle mass and bone mass during pregnancy. You should definitely, you can do some of those things that you can't do, like dye your hair. You can go on trips and enjoy yourself. You can fly. You can do all those things and still be pregnant and live a normal life.
Well, now, I will say, in the African American community, Dr. Wilson, we don't put chemicals in our hair during pregnancy for that very reason, because the old wives' tale is you burn the placenta.
Yeah, that really doesn't happen. Those chemicals have to get through a lot of layers to get down there, and it just doesn't really occur. Yeah, so you're okay. You can put what you want in your hair.
All
Make
right.
yourself feel beautiful.
Ladies and gentlemen, Dr. Karen Wilson with us today on Cape Fear Valley Health's Making Rounds Live. Dr. Wilson, we've already talked about this, but I want to stress it again in case someone is just tuning in and they did not hear me on my soapbox last time. The importance and the urgency of getting early and regular prenatal care for both the mother and the baby.
Yes, absolutely, very important. Getting in early, getting the care you need will provide us the opportunity to give you interventions to prevent any potential medical conditions that may be occurring or can occur during pregnancy, such as preeclampsia, and set you on the right pathway to a healthy pregnancy. And again, you want to come in early and develop a trusting relationship with your provider team, those people who are going to bring this special person into your life. So it's really important to be present and going to those appointments.
You mentioned team. Dr. Wilson, how does your team make sure women from all backgrounds get the care and the support that they need?
Yeah, definitely. I think diversity is something that's very important to us, and recognize that there are different cultural backgrounds that people are coming from. So I think, it's important to be aware of it and make sure that you're communicating clearly and speaking to your patients so that they understand the importance of what you're doing, but also recognizing that different cultural backgrounds may bring different barriers, and helping them support and navigate that process and how they can, break through some of those barriers to provide the best health for themselves and the baby.
All right, Dr. Wilson, before we bring on Mrs. Vermillier, is there anything that you want to stress to our listeners? Maybe something that I missed, or maybe there is an important message that you want to get across to our listeners before I let you go?
Yeah, I think we are here to support them through their pregnancy. All patients who are pregnant out there, if you have any questions or concerns, feel like you need to come see us. We are happy to see you and chat with you and kind of go over your concerns and either address them or, make you feel better about what's going on.
And can you give them the contact information?
Yeah, we're through Cape Fear Valley. And I have to apologize. I'm very new to the system, so I do not have my phone number memorized. But we're at the Cape Fear Valley Perinatology. The address is 2109 Valley Gate Drive, and we're very close to the hospital.
All right. Ladies and gentlemen, Dr. Karen Wilson, obstetrician and gynecologist specializing in maternal fetal medicine at Cape Fear Valley Health. Dr. Wilson, thank you for taking time out of your busy schedule to be with us today. And thank you for getting on that soapbox with me to get these young ladies to get into prenatal care. Thank you so much.
Well, it really was a pleasure, and I'm happy to get on that soapbox again anytime.
Ladies and gentlemen, up next, we have we're going to introduce the newest member of Cape Fear Valley Health's marketing team. Her name is Shelby Vermillier, and she is going to give us the inside scoop about an event that is coming, and she's going to give you more details about how you can win those tickets to Cape Fear Botanical Gardens Halloween event, Botanical Garden event. Cape Fear Valley Health's Making Rounds Live. Make sure you stay